Hi, and welcome to CoDesign Conversations. I'm Liana Mestis, the Deputy Director of CoDesign Collaborative. We are a remote-first nonprofit with a mission to inspire social change through the transformative power of design. If you aren't already involved as a member, I encourage you to become one and take full advantage of our virtual and in-person programs and publications. One housekeeping note, please go ahead and leave comments and ask questions at the bottom of the page. I'll ask these at the end via Amy Haymans, our incredible and talented moderator. I want to take a quick moment to thank Coforma, our partner, for their support and generosity, and Amy Haymans, again, CEO of Beneficent, today's moderator. Thank you, Amy.
Thanks so much, Leanna. I'm so excited for today's conversation. I'm Amy. I am founder and CEO of Beneficent and a member of the CoDesign Collaborative Board of Directors. And because I've spent my career focused on improving health experiences and designing for healthier futures, I'm so honored to be moderating today's CoDesign conversation. This ongoing LinkedIn Live series focuses on the approaches both public and private organizations are taking to deliver impact and outcomes. So our topic today is healthier futures. We're living in a moment of serious disruption in healthcare, but rather than just lamenting on the current state of affairs, this discussion invites us to take a futures lens so that we can begin to imagine not just how to fix what's broken in healthcare, but how to design what's next. So we're going to hear from our amazing panelists, diverse perspectives from a patient advocate, a futurist, an academic leader and public servant, to explore how we can turn this moment of disruption into a catalyst for meaningful change and transformation in how health is understood, delivered, and experienced. So I'd like to welcome our panelists. First, Dr. Zaina Kayet, a health futurist, adjunct professor, and chief program officer at Canadian Healthcare Foundation, AMS Healthcare. She since makes the forces, shifts, and trends propelling next ways care can be delivered and experienced. So welcome, Zaina. Hello. And we also have Erica Olinsky. She is a board certified patient advocate and fellow of the American College of Health Data Management, where she champions patient empowerment and the responsible use of health data to improve health outcomes. And Claudia Williams, she is Chief Social Impact Officer at the Berkeley School of Public Health, where she leads initiatives that strengthen public health infrastructure and advance health equity through data-driven collaboration. She also spent quite a bit of time in the government as well. So we have amazing panelists. Welcome, Claudia, Zaina, and Erica. Thank you so much for joining us.
Hello.
Thank you.
Woo-hoo. So getting started, Erica, you first. So you've worked in the business of health, but you've also experienced health as a patient, as a caregiver, and as a nonprofit CEO. What's giving you the most hope right now?
I feel like we are at this inflection point, and I feel like we say this all the time as well. But obviously there's a perfect storm of forces underway that are fueling a ton of optimism. And I've had a lot of things happen, I suppose, that would challenge that optimistic approach, but I have resolved to the fact that I'm a glass half full person at this point. But the forces at play that give me the most optimism are really this convergence of artificial intelligence, which of course we're hearing everywhere right now is upending everything that we thought we knew about technology and even our place really in the world as human beings. But there's also this, at the same time, an increased awareness around just nervous system health in general and how each of us manage our own experience as a human being in context to this modern world. And by way of that attention on the nervous system, I think that there's also a growing awareness around something called trauma-informed care, or even really trauma-aware care, as it applies to healthcare delivery. And I believe truly that part of what's bringing humanity back into the care delivery process is this increased attention to what it means to be human and what it means to experience the delivery of care. And then how does that experience of care as a human being impact outcomes that we ultimately are able to achieve if the care is delivered in a way that honors and acknowledges that we're human beings and we may be in a fight or flight state of mind when we have something really scary happen with our health.
That is so true. That's a beautiful perspective. Shifting to you, Claudia, I wonder if you're seeing glass half full or glass half empty, but if I know you, it's probably glass half full. But you came from government working on systems level challenges, and now you're at Berkeley focused on social impact. So from your perspective, what do you think the best opportunities to make an impact at scale are right now from your perspective?
Well, I love the topic of this whole conversation, and it aligns beautifully with what we've been thinking. We just hosted an unconference for our whole community called Health Futures, Bold Ideas for Uncertain Times. So I have been very much in the cohort of people that are saying, can't be deer in the headlights right now. Public health is being decimated. Public universities are being decimated. This is our time to own the future, which seems contradictory, but I don't think it is. And I think I was recently interviewing Mark Cuban. We were just talking about it, and he really has gone about trying to mess up pharmaceuticals and the way we purchase them, and the fact that the prices aren't transparent and it's too expensive and all of that. And I think that points out that there's so much in healthcare that we just accept, that we're like, let's make a little innovation over here, but all the rest of this we can't change. And I think this is the moment to stop accepting that. And Medicaid is a good example. Medicaid cuts are coming. It's going to be really painful. It's also the time when we can make Medicaid work for humans. We can make it less complex for both providers and people who are enrolled. We can provide better access to care in a simpler way. So I actually think this moment of crisis, which is very felt across the things I care about, Medicaid, public health, community health, is our moment to design the future we want. And we'll talk in a minute about timing, and find the timing. I'll have that ready in your back pocket, so the minute you see the glimpse of an opening, you're ready to move into that and build those partnerships that let you build for that future.
Mm-hmm. I love it. There's opportunities for disruption and disintermediation. And so let's pounce on this moment. Zaina, you're our time traveler. So what signals and trends in global health, because we tend to focus on US, but there are other things going on in the world. But what signals and trends are you seeing that you'd like to see take hold?
Yeah, I think first of all, I love this this conversation of, like, I call it being the protagonist of our own future. And I really do think, because a combination of what Erica talked about, like there are tools now to do something about it and mechanisms. And then Claudia's like, you got to hit the bottom of the pool to push yourself back up. So I think the global trends are very consistent with the themes we've heard. I'd say that these are the four. So I never get asked what I'd like to see take hold. I get asked to describe what's going to happen. So of all of it, these are the four I would call out that I'm the most excited about. I think absolutely, to Eric's point, I think there's like a patient revolution on a whole other scale because of both AI, but also the crowd, the ability to find each other. Now, who would have thought Reddit would be one of the biggest vectors for the health of humanity, particularly women's health? And the tools now that people, whether they're patients or not, are like, they're appless, they're deviceless. So there really isn't a barrier to access that there used to be because of what's emerging. I think we're going to have a health commons emerge, where the patients are going to decide what algorithms, when, what data, what's going to happen with that data, and where the profit making will happen after that. We will not let what happened to us with social media happen, I don't think, with AI. And I think that's this organizing I'm seeing. That's one. Two, AI is just going to clean up the sludge. Claudia was talking about interviewing Cuban, and there's just some very low hanging fruit that now these tools can come out. Every week we see an article in the US of like some patient who got a 7-page hospital bill, and feed it to the AI machine, and boom, $200,000 comes off that bill. Or I think it's going to be an awakening when we now start to just take a lot of the information asymmetries out. And stop relying on humans to do a lot of clerical stuff that AI can do better, smarter, faster, and cheaper. That's 2. 3 is radical transparency on data and insights. So, for example, how many of us have a subscription to a company that, we can take a picture of our food and it'll tell us the macros and fat and calories? Like, You can just do that within any GPT, any type of an LLM. Like there goes that whole industry. So I think we're just going to have radical transparency, and there'll be nowhere to hide. And I think value will accrue and competitive advantage to those who build for that, versus try to keep holding on to the past. And then finally, all over the world, everyone is finally moving out of sick care and into upstream health, including population health and public health. So around things, I see a lot of movement on housing, on food security, food quality, food access, and now dental. Believe it or not, oral health, I think, is going to have a renaissance as the window into your health. So that's my summary.
Yeah, that's so good. I'm wondering too about the algorithm sort of, as many health organizations have built business models, if the algorithm might disrupt and take over to a certain extent, especially if it's providing, if GPTs are providing and LLMs are providing decision support, that it could be also transactional and sort of disintermediate the middlemen to a certain extent. That's going to be interesting. I wonder too, Zaina, just to stick with you, can you share a story or example where you've seen, because I mean, I'm in futures thinking too, like we talk about signals, trends, where things are going, where they could end up, but have you seen anything like really amazing happen to an organization or community or system that embraced futures thinking to change the trajectory?
So we could do a 4-week podcast to answer this question, because this is what I do all day. I work with organizations to bring futures and foresight, and I'm sure you do, Amy. But I'll just give one example because I think it'll pull the threads of what Claudia and Erica said. So in the Netherlands, I used to live there. They did a major commissioned work called the Dutch Public Health Foresight Study. That was 2018. A very comprehensive approach to what's the future of public health, but led by foresight. There are like some nonprofit agencies that were vital in the foresight space to making sure that was the methodology. I'll just kind of dial forward. It led to 2 massive policy innovations at an entire population scale in public health that would have never been there if they didn't take a foresight. So I think that's a good one. And then I'll maybe just bigger picture. I just came back from Dubai. They have the Dubai Future Foundation. It's an entire foundation that is setting the strategy using only foresight for the entire country. And health is just one of the things, So what's the built environment, education, all sorts of other infrastructure, energy. So that they've outsourced that work to the Future Foundation, and it's direct tie to decisions about money being allocated, including health, is to me like the holy grail. And Singapore's been doing that for like 30 years already.
Amazing. Yeah, the connectivity between, of course, social drivers of health, but also, different industries. I mean, it's all connected. Everything is connected. So Claudia, again, back to this moment of disruption we're in. Can you remember a moment when a moment of disruption like this led to something unexpectedly positive, like new collaborations, new ways of listening, new models of care?
I'm going to share an example we all lived through in the news because I lived through it personally, which is after years of threats, the ACA finally launched, right? And the big launch day, we were seeing lots of people coming in and applying for this new coverage, and the whole system crashed. So remember, this was Obama's number one priority. It's the one that he was attacked on left and right. And my boss was Todd Park, who's founded and taken public multiple companies. He was a CTO. He had a very visionary agenda. And he literally got the call from the president that said, I know this isn't your job, but I need you to go fix this. So the reality is that was the last thing Todd, of course he was going to do it. The president calls, you have to go help out. But he was trying to build out a future of government that was digital, that was innovative, that brought tech talent inside the fold, not just being in the vendors. So the rest of us in the office basically didn't see Todd for months. And it was a Time magazine front cover, so we can all go read it again. And he kind of went around and just gathered a group of people, and they went off to this, random place in Maryland, and they were there for 3 months. fixing it. And what he did was also brought together the existing team with this new team, because everyone was trying to scapegoat like the vendor, saying like they messed up. And what they found instead was that the system was super messed up. Like basically was a very waterfall. Things would get designed and then they go through like 10 layers of government bureaucracy, and then they come back down through the 10 layers of government bureaucracy. And then by that point, like new problems had cropped up. And so, yes, the website eventually went live and it was reformed, but it provided this really interesting opening to actually do the thing he already wanted to do, that he'd already written the memo to the president about, which was, why do we always contract out the talent we need? Why can't we actually build modern technology tools and rapid time based on human-centered design right here in our very own teams? And that launched the U.S. Digital Service. It launched the Presidential Innovation Fellows Program was already going on. But this idea of actually building technology and building product that works from the inside, not by vendoring it out. And it was another example of like, he already had built that idea, but the moment wasn't right. And after the crisis, when they saw what could happen, you know, Todd came to our Christmas party with like hair down to his shoulders because he hadn't had a chance to even get to the barber in those months that he was doing this work. But it showed, it was the see, touch, feel for a future that was different from the one we were in, which could have, that event could have actually deep sixed the whole ACA at that moment. So I think it was a success on two levels. One, we have the ACA that we hope we can keep on enjoying. And the second was really showing what's possible when you take this other approach.
Yeah, thank you for that. And for reminding me of Todd Park, because I met him when he keynoted at one of my conferences, and talk about just a genuine, kind, energetic person who, you know, dedicated themselves to public service. So like, you know, not having time for a haircut to like fix it for all of us. And I mean, that's that kind of, call it what you want, servant leadership for the public good, you know, like the passion. I mean, really, that's what I see in health all the time, and specifically across government and nonprofit, and even corporations. Like, there are good, kind people even working under capitalist structures, actually trying to make things better, which is wonderful. So, Erica, how about you? You know, speaking of, you know, nonprofits, community-led innovation, grassroots efforts, what can large corporations or large organizations adopt from kind of that more grassroots community-led innovation approach?
So I've been thinking about this a lot lately because I've been reflecting on my really main reference point when it comes to transformation. Without spoiling too much, you know, I'm not that old. And when I started my career, you know, social media was really taking off as a revolutionary force. And so I was reflecting on the momentum that the industry gained in its own innovative developments as a result of those social media innovations, and using that as a framework to maybe imagine what's possible with AI, right? It's not a one-to-one, but I was thinking about this. And early on, before algorithms, we had social media really built on this kind of chronological feed of information that we would subscribe to, and just wherever it fell in the timeline of things was what you received. And so many communities were born from that workflow. And I think that's part of what's also bolstering Reddit's success these days, is that there's an inherent authenticity that comes with information delivered in that way, where you're not having some decision-making framework decide what it is you ultimately see, but it's just an organic conversation that exists virtually. And the thing that I remember observing about communities that gained momentum in that era, that were built on authenticity, that still took advantage of the tools that were emerging at the time, there were kind of a few different principles. The first was consistency. And, you know, I think so organizations, it's important for them in the current context to be consistent. They don't have to necessarily have all the answers, but I think consistency in part is also showing up consistently to different conversations, showing up to different events, showing up to even consuming information on a regular basis. If it's chiming into one of your favorite podcasts or reading a certain media outlet consistently. But I think consistency is a part of that. Also, recognition of others doing really good work And so I think when we look at what AI is doing, just as an example, to the current marketplace, we should be celebrating those that are embracing and teaching others what they're learning through their own kind of organic use of that technology, and celebrating that publicly, because that does several things. It encourages community. It shows others what's possible if they participate in that way. It encourages through example what you can learn. And then it also rewards people too for contributing back to the community. And again, Reddit does this beautifully because you can actually vote up comments depending on the quality of that comment. And that's really inherently the only algorithm that exists on that platform. And I think that's part of what's also bolstering its current influence on things as well. The other topic, or I guess the other thing that comes to mind by way of also acknowledging those that are contributing to the community meaningfully, is also those that are choosing to facilitate some of that conversation, making space for conversations, is that they're also willing to just roll up their sleeves and be involved. I think none of us are able to own anything that emerges from the era in which we're in. And I think that there's a sense sometimes of a kind of frontier land grab. But the reality is none of us can actually own what's ahead, but we all can contribute meaningfully to the direction in which it organically develops. And so I think these are all just good things for organizations to keep in mind as we all face these unknowns together. And as a reminder too, an organization is just a collection of human beings that have a shared mission and vision and mission. So we have to continue to honor the individual as much as possible. And that includes honoring their own autonomy and their ability to make decisions, which is only possible through authentic and vulnerable discourse.
I love that. Yeah. Transparency, community, building trust, opening up space for humans to connect. I mean, which is, of course, what we're all thinking about is, can AI actually help us have even deeper human connection? Or will it sort of get in the way that some of the other technologies have? So that's beautiful. It's, in terms of imagination and urgency, Zaina, I'm wondering, what do you think the best way is that we might aspire toward kind of the futures that we've been hinting at and discussing, ones that are, involve prevention, involve community, are making an impact at scale. So like aspirational futures versus de-risking what could go wrong, de-risking those dark futures. How do we balance those two things?
Yeah, and then you've got, so to me, that's like the pull from these two futures we want to explore, and then the weight of the past, which is all the problems of today, which are relentless. They're getting worse. Supply and demand is out of whack. So, I wish the problem for people, honestly, Amy, was how do I plan, de-risk this future I don't want versus create? Most is like, I don't even have capacity to hang out in the future because people are dying, right? I have to do my thing today. So I think first it's just a little bit more futurism versus always nowism, because we're like 100% nowism most of the time. And it's too easy, and there's never enough work in nowism for anyone. But we know it'll never get you to anywhere close to the future you want, or even surviving today. And so I try to guide organizations with, whatever your community is, maybe 10% of your capacity time, 3% is to start to just hang out in the future you want and take the steps like we've heard, versus always 100%. So, and by the way, when I present that to organizations that nothing about now is what they want, they're at like 90% of their time is the future, because there's kind of no point of trying to protect the past. So you've got to be somewhere between those. Okay. So that's one. And then in terms of once you know that, so maybe you want to spend 10%, 5% of your capacity on the future. It's actually very, very confidence building. You feel like you're in control when you're the protagonist of your future. So there's no dichotomy of, these bad directions things may go versus the, utopia we want. You're just going into it eyes wide open. At least if you're hanging out in those unintended areas, you can now plan for them now. You can make sure the things you're choosing today keep you away from that path that you've just seen what happened. I'm just going to give a very concrete example. I've been doing some work with the different agencies of government that help plan for our next zoonotic virus, not if, but when. And they were obsessed because of what happened last time with, supply, right? Because everybody was fighting it out for getting the Moderna and the AstraZeneca and the tests and the PPE. And, it became a big supply chain. There was industrial protectionism, nationalism, whatever. So they thought they were set up to make sure we've got manufacturing supply domestically, for the next one. We did a bit of a futures exercise and played out all the things that might happen if we play out today's signals and the misinformation and disinformation that's happening now. You play that out, and if another pandemic hits, guess where the priority now needs to be? So they didn't just put their hands up and go, oh, disinformation, it doesn't matter. I can't, they're like, yeah, now they just make some better choices to manage the risk. So it just gives you a ton of control and confidence when you kind of incorporate the future into your plans today, whether it's the future you don't want or the future you want.
I love that. Thank you. Yeah, it is confidence building. I recently did a futures thinking workshop with junior congressional staffers who make health policy, and they tried out some futures thinking methods and frameworks, and they were like, we wish we could do this all the time, every day, to figure out what is the future of health policy in this country. So they found it extremely encouraging. And that brings me to you, Claudia, because you have experience in setting public policy. How do you think our approach there can empower these aspirational futures or enable bold experimentation as opposed to constraining it?
It's a big question. And it's interesting, like the way I think about policymaking and regulatory action, which doesn't apply to every scenario, but it's the ones I'm most excited about, is to think about the policy as a spark in an ecosystem, not as a determinative, like things will happen this way and we will regulate, but more like it's very futurist. It's like, what is that future we want? What would be the first spark? And how could you build that fire and cultivate that hearth as you go forward? So I'm going to give an example actually from this administration where I think for me, the template is something like, what policy can do really well is create alignment around a goal. So it can say, like, this is a priority right now, and I'd like everyone to focus, like, look up at the board. Like, let's go, I'll look at the board together. And then flexibility for how you move towards that future, but accountability for outcomes. So there's the goal, the flexibility, but then like, let's be accountable. And I actually think the rural health transformation, the $50+ billion that's being dispersed over the next month is a good example of that. They've said, let's all look at the board, rural health. It's a big issue across the country, not just in highly rural states, but everywhere. We're going to give out this money based on some very broad goals, but you can innovate around with the way to do that. And future rounds of fundings will be based on what the outcomes are that you actually achieve. So we're going to have an iterative approach to financing that encourages people to experiment and show impact. I mean, there's lots of bad policy background around this, like Medicaid cuts and everything else, but I actually think it's an interesting template. I'm going to share another example, which actually does not follow this template, but I think it was the right choice in the right moment. But we can have a long debate about this over a cup of coffee or a wine, which is meaningful use, the most hated policy on the earth. And what it did is it paid doctors and hospitals to adopt electronic health records. I was part of the policy team that developed it. At the time it started, less than 50% of doctors used electronic health records. 5 years later, it was up in the high 80s and 90s. So this program was very prescriptive. It said, you will adopt a system. It will look like this. Here's how much money you're going to get. And that had all kinds of problems in terms of innovation. And Judy Faulkner has talked left and right about this. It didn't allow us to innovate it, but it allowed us to achieve a doubling of the adoption of EHRs, and everyone could calculate a blood pressure. Everyone could monitor weight. Everyone could do this. So it had some negative effects for sure. But I think that's an example of a policy that didn't follow the innovation template, but followed the adoption template where we wanted something to happen very quickly. So I think one of the tricks as a policymaker is to ask yourself, what is the nature of the thing I'm working on right now? Is it one where we need a lot of innovation? Is it one where we really need to build out futures that don't exist? Or is it one where we like something has to happen and it needs to happen now, and we're going to actually squash a little of the innovation in favor of getting things to move more rapidly?
Yeah, that makes total sense. I mean, even just considering for a moment, what is the future we kind of want to work toward, and then backcasting, figuring out what are the steps to get there. But your point about implementation and speed and looking at those outcomes, that just that pure outcomes focus, like what outcome are we trying to achieve, and what are the best ways to get there? Amazing. So for our audience, if you have questions for our esteemed panelists, please drop them in the LinkedIn box there, and we'll get them answered. But I am curious, Erica, so if you could invite people across the ecosystem, patients, policymakers, providers, innovators, caregivers, to do one thing differently starting tomorrow, what would it be? And especially in the direction of like meaning, transforming in the direction of meaning, what kind of like collaboration or individual action do you think could get us one step closer to some meaning?
So I think, broadly as an industry, we need to be inviting patients, and Stacey Hurt beautifully does this. She's another big patient advocate in our space. She calls it an inclusive term, where patients represent both clinical patients, but also the caregivers, and also the patient advocacy groups and the patient advocates that are out there doing work on behalf of the patients and their care delivery experience. We need to be inviting patients to the conversation and inviting them in the room from day one, and we need to keep them in the room. They cannot just be honored or have a checkbox to the conversation early on and then say, oh, we did consult them, but then we went off and did this other thing. We need to be inviting that stakeholder group to the conversation from the very beginning and keep them involved in the conversation, even when it's difficult, because that at the end of the day is who we are serving. Point blank, over, non-negotiable. That is who we're trying to care for. That is who we're trying to influence.
It's why we have jobs.
It is. It's it's who we're serving at the end of the day. And for us to do this right, we need to invite them to the conversation and make sure that their perspective is continually honored iteratively through the processes that we implement. That has to happen. And then, on the other hand as well, that stakeholder group, the patients, as an inclusive term, they need to be just sharing their stories. AI, one of the things I'm most excited about with AI is our ability to take unstructured data and use that meaningfully into something that's actionable. That is incredibly exciting for me as somebody who works in healthcare, because stories are essentially the only data point that we have that authentically represents how care is delivered and the outcomes that are achieved as a result of that. We have lots of measures in which we can measure that performance, but the story at the end of the day is the most comprehensive data point we have from the patient's perspective on how well we're doing. Mm-hmm. And more than ever before, in an unprecedented way, AI is going to allow us to take those stories at scale and make them actionable. Help us make sense of maybe what, 300 patient stories, what common themes exist between those 300 patient stories that were just unstructured narratives that we can feed into a system, and perhaps even, inform an LLM that we could interact with potentially. They need to share their stories. So it's really two ways. We need to be inviting the stories to the conversation so they can influence our development and decision making, but we also need to be encouraging us as patients, as caregivers, as all of these other, identities we have as that key stakeholder group. We need to be sharing our stories as well.
Yeah, I love that, as the story providing the nuanced information and clues that really help understand the full picture of somebody's story, and could then pay it forward, help the next family, patient, et cetera. And how do we structure that and scale it? That's a really fascinating insight, Erica. And participatory futures, just like co-creation in participatory design, participatory futures are a thing. Like, let's literally invent the future together, or imagine a better future together. But Zenas, you're on the front lines of integrating futures thinking into solving our most important societal challenges, especially in health. What needs to shift in our mindset or culture to make futures thinking more a part of how we design health systems?
I mean, I'd say if like, what as Claudia and Erica said, if you asked me this a year ago, I would give a really long answer, but I think we're there. I think people are realizing, one, the acceleration from all of this AI to the power of AI. Us futurists, we used to do like we would start 10 years out was what we called the future. And then you worked back to today. Like we're talking a year and a half now. So I just think we're all there. And my litmus is like the demand I get and you get, Amy, for these types of sessions, because the tools of today are just not fit at all for the magnitude pace of change. So I think that's one. But within that, I'd say, like I said, start with making a call that you are going to do futurism, or at least futures thinking a little bit. And then the act of doing it, of doing participatory co-design in the future, doing backcasting, doing scenarios, is mind shifting. Like the molecules actually change by doing. And so then it's a self reinforcing loop. And I see it all the time. So I always say, like, you can't unsee a future narrative you've drafted. You can't unhear it. And, those of us who do this work, we don't just do like 6-point Word documents to describe the future that we're imagining. It's very experiential. It's very visceral. It's got artifacts and video and, it's got smell. So, and then the only other one I'll say of why futures work can change your mindset pretty quickly and you kind of can't go back is, those of us who do this all the time, especially when we show extreme futures that may play out, whether they're dystopian or utopian, we do this all the time. So it goes well past what maybe, Amy, you and I, like what I call is our absurdity threshold, because we're used to it. But for the everyday person who doesn't do this often, that's like, it doesn't take much to get there. Well, that's where comedy and humor comes in.
Which is fun, yeah.
Because as soon as it's so absurd, like think of a comedian or watching Seinfeld, your brain is like, what? And that's what happens in a lot of this work, which I just think helps change the mindset, which is why I think people get addicted to this. Why you're that congressman thing you did. They're like, I want more of this. Yeah. Because it's energy creating. It's not.
Yeah, totally. And I think people are accepting it because, or just they realize how important it is because there's so much uncertainty and we're in a ludicrous time. So to imagine something ludicrous doesn't seem as ludicrous.
It's not a stretch.
Yeah, like I have a student, I'm teaching a class in futures thinking right now. And one of my students is looking at how could athletes in the future use CRISPR to edit their genes so that they're superior athletes. And it's like, well, that's going to require funding, which might need corporate sponsorship, which might lead to human branding and just like a NASCAR, but you're human. Like you end up going into these, strange places, but like the current state is strange. So it's not too.
And by the way, I'll just throw one in now. I did one all about obesity and how it underpins cardiometabolic disease and most cancer, and GLP-1s, are starting to make a dent. It's affecting the food system. I literally just saw an article today where we're in clinical trials of a way for your own body to manufacture its own GLP-1. So all those barriers that Mark Cuban, Claudia, was probably trying to get to on the cost of these GLP-1 meds, it's hugely inaccessible for a lot of the people who need them. Well, if that future plays out, then we don't have that problem at all. Then we go back to 1970s levels of obesity. Then what happened? Anyway, it gets very exciting if you just kind of lay the facts in front of people of all these different steps, like you did in that example, Amy.
Yeah, absolutely. So we do have a question coming from the audience, and it's about how we've been talking about putting people at the center, patient centricity, human-centered design, empathy, co-creation, and yet we often talk about it as though it's a novel concept, and it is very difficult to do. And there's new concerns, like with AI, like if we have synthetic personas, are we actually going to talk to people anymore? Or are we just going to rely on the LLM to make us human centered and whatnot? So any thoughts there on how we still need to talk about this because it's still not happening?
I have an instinct and a future I don't think it's going to come. This is one of the things Mark Cuban talked about. He's like, I said, how have you been able to be so bold and courageous? He said, I'm not. I just chose not to work within the system. I've been able to accomplish everything I've been able to accomplish outside the system. And I think we've always seen examples of radical innovation from patients themselves. But now, if you imagine the digitization of health data and the ability to actually download it and have an API for your own data, combined with AI, combined with just utter frustration and impatience, I think we're going to start to see radical changes that are patient driven that will then create such a threat to the existing order that it's a, Clay Christensen all over again. And maybe it'll happen through the funding of some of those efforts from some source I don't know. An example I just again interviewed on my podcast David Fagenbaum. The episode's not out yet. He launched something called Every Cure, which is basically taking drugs we already have and repurposing them for all of the rare diseases with patients at the center of that innovation, because he did it for himself. He almost died 5 times and found a drug that would cure him. So those will not be the whole answer for what we need, but I don't think it's going to come from within the systems that are sclerotic and aren't motivated right now to make those changes.
I'll add here, I think historically, one of the areas, it continues to be novel because the reality is it's not happened. So I think that's a big piece of this. Historically, we've had this big challenge. And I think this comes off a lot in like patient advocates that do a lot of speaking and definitely put themselves out there. There's a really hard challenge when something's so personal to not lean hard in on what I call like the Sarah McLachlan effect, right? Where this is a really sad story. This really horrible thing happened to me. This really horrible thing happened to someone I care about. And that should be enough to inspire change. And the problem is, I think as an industry, is we've really struggled. And it's not a matter of empathy. I think everyone is very, sympathetic and empathetic, to be honest, to the patient. And they all do want what's better for them and want them to not have these horrible things happen. But making actionable insights from those stories has just historically been a monumental challenge. And the other dynamic, too, is that human beings are inherently complex. Even the most simple hypothetical scenario of let's say a patient breaking their arm and they show up in the emergency room and they get their arm diagnosed, they get the break confirmed, they get it reset, they get discharged, go home, get their PT ordered, and then everything's better, right? That's even a very straightforward hypothetical scenario that might be used in a patient experience exercise. There's so much more to that individual than just that arm breaking, right? Is that arm their dominant arm? What's going on in their life at that time? Are they a student? Are they note taking? What other things are complicating their experience of care beyond the care itself that's being delivered? And I think that just being human is inherently complex. And like I said, even the most straightforward examples are still complex. And I think that complexity has really, in combination with that Sarah McLachlan effect, has really prevented meaningful integration of those stories into the systems that we've been designing as a result of that. That said, I continue to be very excited because I think the tools, like we said here, I think the tools are at a point now where we can actually, in fact, do something with that.
Yeah, absolutely. Yeah. And I've heard even folks talk about empathy fatigue. And I think it comes from a point of feeling, but also feeling powerlessness. So being able to transform those real human experiences, get insights from those human experiences. I mean, you're basically making the case for researchers to exist. So thank you for that, because it's the researchers' job to work with humans to gather these insights and make sure that we advocate for time in the timeline, budget to be spent in a constant curiosity and in partnership with the people we serve. So thank you all so much. You are hugely inspiring to me, and I know to everybody who is tuning in here. I have a lot of gratitude in my heart, not just for this conversation, but for the fact that you exist and continue to do the work that you're doing, because it's so sorely needed. And I will say that If you liked this conversation, then you will love the Dignified Futures Conference, where we will spend 2 days on topics like this and learn from speakers like our esteemed panelists. Claudia was a keynote the first year of the conference in 2024, and Zena is a keynote at the upcoming 2026 conference, March 18th and 19th in Chicago at the Institute of Design at IIT. So I hope to see you there, and thanks so much for joining us. Leanna's going to close us out.
Thank you, Amy. Thank you, Dr. Kayat, Erica, and Claudia for your insights. And again, Coforma for supporting today's conversation. Tanya from the Coforma team did share a resource in the chat related to today's conversation. So take a look at that. And thank you all for joining us. We do have another CoDesign conversation scheduled next Wednesday, November 12th on operationalizing AI, and in December on voter empowerment. Date soon to be announced. Please get involved, follow this series, learn more about our work at codesigncollaborative.org. Thank you again, Amy, and to our panelists. We really appreciate your time and your insights, and I look forward to re-listening to this conversation again soon. So thanks, everyone. Have a great day.